I toss and turn a lot. I can't stay in one position for too long. If I lie on my back for too long, back hurts. Lie on my side for too long, starts to hurt. Stomach for too long, starts to hurt.
Whenever I was having those flare-ups, I just couldn't get comfortable. I lay on the floor sometimes. I always was putting the heat on my back.
It seems like all people that have bad backs, we all have the similar story. Getting good sleep, it's something a lot of people take for granted.
So it's very important for me to spend some time on my patient education on sleep habits. And whether it's the mattress that they're sleeping on or the position that they sleep.
I've got a very firm bed that I sleep on. It's pretty much like sleeping on concrete.
Oh, sleeping was the worst. I couldn't sleep, and I'd try and put a pillow under my knees. I'd try and sleep propped up. It was kind of like a bad commercial.
Sciatica, if you've never had it, is very painful. Sleeping at night is difficult with it. So you start using pain pills and things of that nature to try to combat it.
And there's some things that the doctors would prescribe that were really strong painkillers, and sometimes that would help you sleep for a couple of hours, but then you're up tossing and turning all night. And I didn't take it again too late because I had, to drive the kids to school in the morning, and yeah, it's like a vicious cycle.
For spinal stenosis, by and large, the decompressive surgeries are designed, in my experience, to correct your standing time. If you're laying down, you can't sleep because you're in essence sleeping in the same position you are standing, and you can't sleep, or we can relieve that compression that you have there, then we triple your sleeping time and we triple your standing time.
I have 3 grandchildren. There have been various times where I just haven't seen them for a while.
Not being able to sleep in certain positions. I'm always sleeping on my side with a pillow between my legs.
I tell patients all the time, it's gonna hurt when they get in and out of bed. When you change position, get in and out of bed, it hurts.
One of the first things that we did, we made a decision before we even went to the hospital to look into getting a hospital bed into our house, which I think is critical.
And people don't need to be too paranoid that they think they may be messing up the surgery, because it hurts when they get in and out of bed. The screws and the grafts are so stable, you're not gonna mess up the surgery getting in and out of bed.
The things I normally do with them, go to the park, have a sleepover, those things aren't possible when you're only sleeping on your back in one position, you're in a lot of pain, and you're basically trying to get through the day and the night, really.
It did 2 things. It gave me a bed that leans up and you can get yourself more comfortable in the bed. It also allowed my wife to get back into her bed, which she appreciated. So we had that in there, which made all the difference in the world.